boys and girls, ladies and gentlemen, and welcome to the Real Talk. I hope you're all doing well, keeping safe. And if you're new to the channel, welcome. This is a platform for open minded individuals. We can come together, share their ideas, share experiences, and help each other and try to make this world a little bit more positive. And if you're new to the channel, please subscribe, like the video if you like what we're talking about, or if you what the contents we're presenting, and share it with your friends and family. That's how we grow as a channel and as a community and try to reach more people. And I really want to thank everyone. We've reached over 100 subscribers. So thank you for your comments, thank you for your feedback, and thank you for sharing and this positive message that we are trying to spread. And today we have someone new on the channel, and like we said, we're growing this community, which is great. Dr. Davina, all the way from South Africa, welcome. How are you doing?
Hi guys, I'm good, thanks. Thank you for having me today.
No, it's a great pleasure. And for the first time on the Real Talk, we will have three people. You know, we usually have two-way conversations, but as many of you who already know Triv, who is a regular on the show and he's almost like my co-host. Triv, welcome again, bro. How are you?
I'm good. Davina, thank you very much for coming on the show, mainly because you've saved me 20 to 30 minutes having to just talk to Rail, and that means an absolute world to me. So thank you for coming on.
Yeah, right. He was begging to be on the show, on every show. But anyway, I'm glad that both of you are here. And Davina, um, before we get into the chat, I just want uh, to let the viewers know that we will be talking more about mental health. We did a couple of videos, one with Trev and I, one with a friend of mine, Shreya, who went through mental health illness, and she overcame it. So it was a really good video. I will put the links of those two videos in the description, so please check it out. And like I said, this platform is for everyone, and Davina was kind enough to reach out, and she wanted to come on and share her experience from a medical point of view, because she is a doctor. So Davina, will you please let the viewers know what you specialize in and what you do?
Okay, so currently at the moment, I am working in psychiatry. So I am in the Johannesburg District Clinics. It's basically community health, where I go to a specialist psychiatric clinic every day in different parts of Johannesburg and treat psych patients on a daily basis. So that's my 9 to 5 job, yeah.
Wow. Well, that's perfect, and we have so many questions on that. I'm sure Triv has a few. I have a few, and it's perfect because you do work with patients struggling from mental health issues, and it's so great to have someone who has, the education behind mental health, and how you on a day to day basis encounter these patients. So, Triv, if you can go ahead and start, what do you have in mind? What do you want Davina to share with us?
Okay, so yes, I think the starting point is sort of the definitions or the terminologies that we use, because we hear these things all the time, and one of them, Davina, is um, that somebody is suffering from anxiety or having anxiety attacks. What exactly is that? What is somebody that is going through this? What are they experiencing? What is anxiety?
So with anxiety, it is a intense, excessive, and persistent worry or fear that a person may have, and the way that it can manifest itself is by physical symptoms. So when you talk about mental health, you must always realize that it actually affects your whole body, just like how anxiety and depression does. It's a whole body illness. So anxiety specifically can be associated with, shortness of breath. So you see people hyperventilating, you see them sweating, their hearts are beating really fast, they're having palpitations. So basically, it's them feeling out of control from this worry or fear that they have about something that can be a everyday activity. So with anxiety, everyone goes through anxiety. Everyone has anxiety. If you have a public speaking, or you have a test or an exam, or a presentation at the job or something like that, you get anxious. You get that feeling of worry that something may go wrong. But when it becomes an anxiety disorder is when it actually affects your day-to-day functioning. So that's
Okay.
basically what anxiety is.
The following question that I wanted to ask Davina is, so is the line that we draw in terms of when, like, if you have a piece of public speaking that you're going to have that you have coming up, or you have a test that you're going to do, that you mentioned, then it's anxiety that I think that a lot of people go through, a majority of people will go through at some point in their lives. Would you draw the line in terms of something that you should seek help for, in terms of if it's something that is affecting your daily life? Is that where you think that we then need to be looking to get professional help, or to speak to friends and family?
Yeah, so obviously, the way we diagnose a disorder is by a certain criteria. So, with anxiety specifically, you have to be having these symptoms for at least 6 months, and most of the days for 6 months. And obviously, it seems like it's a long time for that to be, 6 months of this constant worry. But that's where we then say that this is actually now a disorder. But before getting to the 6 months, it must also affect your daily activities. So now you are backing out of that presentation that you normally would have done. Now you won't go and write that test, or you fail the test because you're so anxious. So sometimes people get so anxious that they won't even leave their house. They're worried that something will happen outside their house. So that's when people should actually seek help, is when it's stopping them from living their day-to-day life.
That's the thing, right? Well, and Triv asked it already, but now I just want to focus on depression, because there's a really I see it as a fine line. We don't know when we need to seek help with depression, and that word I think keeps thrown around a lot, but we don't actually know. I don't think everyone understands what it means. Oh, I'm depressed, or I'm feeling down. But like, I don't know, I see it like sometimes you can just be sad for a few days, and then you term it as depression.
Yeah.
But then when is it classified as clinical depression? Like I mentioned, my friend was on the channel and she was diagnosed with clinical depression. But then, like, for everyone else out there who's new to this and who has no idea of when to seek help with depression, and when you can be classified, there's a category, as clinical depression. When do you use that term?
So, with depression as well, there's it's characterized by a persistent low mood or a loss of interest in the activities that you normally would enjoy. So, like you say, sometimes you feel sad. Yes, everyone feels sad. You're sad for a few days, but you eventually feel better. You will start to do the things that you used to do before. With depression, this will be prolonged. It will be persistent. They don't find joy in those activities that they used to find joy in before. Not only is it just the mood now that is the problem, it's also affecting other aspects of their behavior. So things like poor sleep. You're not sleeping. You're either eating too little or too much, which then causes you to gain weight or lose weight.
Yeah.
You can't concentrate well, you're very forgetful, and you also have feelings of, hopelessness, emptiness, and guilt. Sometimes you may also have thoughts that revolve around death or suicide. So when those things start to happen with your low mood, then that is when you should seek help. And for us as well, we say it should be like a month period of these symptoms. But obviously, if this is going on, you see it's affecting your daily, your social life, your occupational life, then you should seek help as soon as possible.
Okay. Triv, you can go with the next
Yeah.
question. Thank you, Davina.
Yeah. Sure. So what do we do, Divina? What do people from the outside watching somebody, a friend, a colleague, a family member? Because I think it's a little bit overwhelming for somebody watching it as well. You don't obviously want to push the person too far, to push them over the edge. And like I think Ryan and I mentioned in one of the first videos we did about mental health, is that you
Yeah.
know it's I think it's you run the risk of giving the person the wrong advice, especially when you're not qualified to be giving people advice. You're speaking to them as another human being who's trying to show empathy towards somebody that's going through this. In the professional sense, what if we do notice that somebody that's close to us is, like you mentioned, they're not enjoying the things that they used to enjoy, and so forth? What should we do? Should we be confronting people? Should we be suggesting should we be suggesting that they seek professional help? What would you suggest people do in those sort of situations?
So I think when it comes to helping a friend or colleague or loved one, and if you are the one who's recognizing these things, they may be feeling it on the inside, but they don't know what it is. So I think that it's important that you help them find out what it is, number one. So if you have the experience, you know that, okay, I heard that this is what depression is like, I heard that this is what anxiety is like, take them to get help. I think it's important for them to not feel alone as well. So if you come to them and you tell them, I've noticed that this, and this has not been okay. I noticed that you have been, very sad. You haven't been yourself. What's going on? If they struggle to open up to you, which I think a lot of people do, a lot of people feel like they can be a burden sometimes, and that's why they don't want to open up to people. Give them the option. Tell them, okay, I heard that this is where you should go to get help. So I can come with you. I think it's also important to support them in that sense, that they know that they're not alone, and they know that at least if one person is accepting, more people will be accepting of their illness. So take them to go and get help. Um, Find out what their illness is, whether it's depression, whether it's anxiety, whether it's bipolar, anything like that. Read up on it so you know what they go through and you can kind of empathize with them. I also think it's important not always to just, advise and talk to them, also listen to them. If they're willing to talk to you, let that be an outlet for them. Let them talk to you as a friend. So just offer as much care and support as possible, but obviously not being overbearing. If you can see that it's getting too much for them, rather say, maybe I got you an appointment for this person, or this is where you can go to get help. Um, let's go together, and then just leave it at that.
Thank you, Davina. That I'm sure will is a very helpful as helpful information. And hopefully, the viewers can learn something from that, and pay more attention to the people around them. And my question, which is related to this, right? So let's say you do find or you do notice in your friends or family that someone is going through anxiety or depression, and they've been going it through a while, and you try to speak to them, but they're not really willing to accept. That's a really big, I think that's a big thing with mental health. A lot of people, because it's still, I don't know, in most parts of the world, I feel like there's still a stigma attached to it. People are not very open to speaking about mental health. So what happens, a lot of people they're not willing to accept that they're going through something. How do you then approach someone like that? Because it can get a bit tricky. You don't, like you mentioned, you don't want to push this person and make their problems worse. So what do you do with someone who's being a little more difficult to accept that they need to seek help, or they are going through maybe depression or anxiety or something else?
I think that is where education plays a huge role.
Yeah.
A lot of people are not willing to accept it, or like you say, there's a stigma attached to it because they think mental health means they're crazy. Like that's what people think.
Yeah.
And they don't want that crazy stigma attached to them. But if you read, there's so many resources on the internet. I know in South Africa we have a very good website. It's the South African and Depression Anxiety Group. They have millions, I'm saying millions, I'm exaggerating, but they have many
Yeah.
resources where they tell you exactly what depression is and how you feel. And I think once people read it and they see it, that okay, this is actually how I'm feeling, this is how I'm feeling, they are more accepting. So I think just getting that education aspect across to them makes it more, it makes it easier for them to accept.
Yeah.
But I also think that sometimes people think that, if I go to the doctor, like people are scared of doctors for some reason. I don't
Yeah.
understand why, but they're like, if I go to the doctor, then this is a problem. So there are other options before you get to a doctor, I'm not saying that you will not need treatment, because severe anxiety, severe depression does need medical treatment. But there are other options like counseling groups, so support groups. Depending on where you are, whether you're in a school, a university, corporate environment, there are always health and wellness things around there, whether it's a counselor, a psychologist, they're all there. So I think normalizing therapy is a good thing, and that is what will also help them become more accepting of it as well, as if they talk to someone and
Okay.
then someone with a professional opinion tells them, no, you need to go see a doctor now.
Yeah. Well, thank you for that. Yeah, that it can be challenging, but I guess we all need to be a little bit patient and compassionate with people going through mental health issues. Um,
I
Cliff,
think,
do you have another
Rahul,
question?
another, yeah, it's not so much a question as it's just a sort of a follow on to what you said. I think something else, or a very common thing for people refusing help or refusing to acknowledge the fact that there might be a need for them to speak to a professional. I think men feel that it's weakness. Like, it's
Yeah.
if two guys trying to communicate with each other, for some reason we don't want to, even to our best friends, we don't want to say that I'm going through a tough time. For some reason we feel like it's a negative against us. It makes us less manly, if
Yeah.
that's the right
I
word.
actually
So
mentioned that
yeah,
in the video I did we did on vulnerability, and
yeah,
it kind of links to that because us as men, we're discouraged to be vulnerable. I hope that trend is changing now, but and where I grew up, it was like you said, if you share your feelings, or if you're vulnerable, then you're being weak. But
yeah,
that's not true. You're actually showing courage, that you have the courage to share your feelings and
yeah. I
thoughts.
think it's
And that's
important
why
that
a
we,
lot of, I don't know, Davina, if this is true, but from, like, I know in the UK and around Europe, men suffer more from mental health, or rather they are more higher rates of suicide in men than women. I don't know if this is a general world norm, but this is what happens around here. I don't know if that's true for South Africa as well.
So even here, so like when you are presented or when you do a suicide risk on someone, men are higher risk for committing suicide. It's because they have had these symptoms for such a long time. They've had all, when you talk to them and you're trying to find out what the problem is, they've had every single one of the depressive symptoms, but they just have not been willing or able to just let themselves be helped. And you can see how frustrating it is for them, because when they eventually come to you and they're like, I just want to kill myself, there's nothing else I can think of, when they've
Yeah.
missed all of these other steps that would have stopped that. from happening. So I think that firstly, can I just say well done on you two. You two are guys who are running this talk on mental health. So you can already see that there is a shift in males becoming more accepting and more vulnerable to say. But I think that it needs to be encouraged more. From a young age, where boys are told, when they cry, they're told, man up. Like, you shouldn't be doing that. You shouldn't be ignoring or telling them to ignore their feelings. They're there for a reason. They're there to alert you to something.
Yeah, and this is coming from a medical expert. So, men out there, come on, guys, let's maybe today just share something small with a male friend of yours, or even your partner or anyone else. Let's slowly build into this culture of sharing your feelings and being vulnerable, because in the long run, it will help benefit all of us, and we wouldn't be talking as much about mental health, because hopefully a lot of people then will already know what to do. So Davina, thank you for that. Triv, do you have any other questions for Davina?
Yeah. So there's something that I personally wanted to know. Um, in terms of depression, this common word that we hear all the time. Um, what's normal depression? So if you lose somebody that you care about, so I know you mentioned anxiety, you're looking at sort of a 6 month period if something is continuous and it's affecting your day-to-day life. um when we're trying to help people around us, losing loved ones is something that is unfortunately part of everybody's life. uh, is there a sort of time and place where we're like, okay, so I think now is the time where we need to help this person seek professional help? Would that also fall into the categories that you mentioned earlier, in terms of if they're not willing to watch the football game anymore, if they're not willing to go see a movie anymore, things they used to like before? um how do we balance that out between, like, it being okay for you to be sad, and to a point where, okay, now we need to step in as friends and family and say that you need to get extra or professional help for this?
I think specifically with grief, because that's what you feel after you've lost a
Yeah.
loved one. Specifically with grief, there is a period where it's normal for them to be feeling the way that they're feeling. It would be abnormal if they were not. So generally, I think it's around. I will correct myself later on if I'm wrong,
Yeah.
but I think it's generally a 1 month period where we say that this is grief now, and afterwards it becomes something more, whether it's complicated grief or like complicated grief leading to depression. It is generally a 1 month period. Um, but I think specifically around that time of grief, when the people are going through what they're going through. They've just done the funeral. In different cultures, there's different ways to let the soul rest. So uh, in that period, they generally have a strong support around them, because there's lots of family members, lots of friends coming to visit, coming to see them. So they don't feel so alone. But it's after that when they actually need the support, when
Mm.
they need you. And sometimes people will just send a WhatsApp and say, let me know if you need anything. But instead of saying that, maybe just if you're cooking something, cook something extra for them and just drop it off with them. If you're watching, like you're saying, a football match, invite them to come, and be understanding if they say no, but then just say, okay, we'll do it for the next one. So I think you also need to bring like a sense of normality to what they're going through as well. and to get them into a routine. If you're obviously lucky enough to be in close contact with that person on a day-to-day basis, try and keep their routine going. What they've done before, keep that going for them going forward. But and that's how you can keep an eye on them as well, to see if actually, okay, now you're not sleeping, now you're not eating, um, and then you can say, no, I think you need to go and see someone. And I think it's always a good thing for people to get grief counseling. I know that it's not always available, especially in South Africa. I even think in some of the first world countries it's like it's not available, but grief counseling can really help. It can help people to understand what grief is, why you feel it, and how you can push through it. But I think after a month, if you see that this is not, they're not getting back to normal, they're not coping, maybe they need to get help, or talk to someone about actually what's going on.
Yeah.
Yeah, cool.
Yeah,
I think
that's
that's massively helpful because I think we've all been in a situation where we see people that we care about go through that. We go through that ourselves, and I think I that thing, of what you're saying in terms of you send somebody a message and you're like, I'm here for you if you want to talk and stuff like that. I think what you said about if you're cooking something, take it over for them. If you're watching a football game, I think that's the important things that I basically I wanted to get your opinion on because um, I think it's a commonplace for us all to say, I don't know what to do. Like,
Yeah.
how do I
mm,
help somebody? And I
yeah.
think those are just great ideas in terms of keeping the routine going and stuff like that. So yeah, thank you. I think that's massively helpful.
I also think that it's important to treat them normally. Yes, they've been through this loss. Yes, they've lost, a massive part of themselves. But they also then start to feel like a burden when you
Yeah.
start to handle them with like kids' gloves. They're like, why are you not the way that you are with me? And I think being normal around them and maintaining your own relationship with them the way you would have before helps them massively. It takes away from always thinking and always talking about the person that they've lost, kind of thing. So, and it lets them just carry on with their normal life.
Thank you, Davina. Um, I hope that that will help people and give shed more light on how to deal with the loss of a loved one. But they always say prevention is better than cure. So what can we or people out there do at home to prevent? I mean, obviously you can't help if you can't prevent it if you lose someone, but what can we do just as a to just take care of our general mental health so we avoid things like stress, anxiety, and depression?
So, just general things to take care of your mental health is physical activity. Physical activity helps massively. It's a huge stress reliever. It helps with anxiety, helps with depression. The other thing is to maintain a healthy diet. Um, you can also do like relaxation exercises, or meditation, even things like mindfulness, where you actively practice mindfulness. You say 3 things a day that you're grateful for. Write down 3 things a day. People have like a gratitude journal. Write down 3 things a day every day that you're grateful for. This is what happened today. So you focus more on the good things in life than the bad things by doing that. And then the other thing is that education. I think, I've spoken about education before, and I
Yep.
will not stop speaking about it because I think that it's the most
We
important thing
just
when it comes.
if you haven't if the viewers haven't watched it, Triv and I have done 2 videos on education, and we do mention about mental health.
Yeah.
So yeah,
So
continue.
I think
Sorry.
that is very, very important. And then always be wary. Be on the lookout for things within yourself and things within other people that you can avoid it becoming clinical or severe depression. So if you notice certain things, urge them to seek help, support groups, websites, all those sorts of things. It really does make a difference.
Okay, thank you so much, Triv. Do you have any last questions?
No, I think that was a perfect way to end it.
Thank you so much, Davina. If you would like to add anything else that people can look out for, or how they can seek help, please go ahead.
So, just to keep it short, the internet has so many resources. So within South Africa, like I said, I've spoken about the SADC group before. They've extremely helpful. They have counselors. They have a 24-hour helpline or a suicide anxiety line that you can call. The other things is that, you have healthcare for a reason. If you're not feeling good, you know that this is now starting to fall into depression, go to your general practitioner, tell them. They'll tell you where to go from there. Also use the groups in your area, the support groups in your area. And yeah, I think that everyone should try and normalize mental health and mental health illness as much as possible.
Definitely, that's the brilliant way to end this conversation. And I would again like to thank you very very much for coming on and sharing your knowledge of mental health. And
Thank you, guys.
yeah, Trev, thank you as always for joining us.
It's a pleasure.
Yeah. So thank you everyone. If you're still with us, thank you so much for staying with us and supporting us. And if you out there now, I hope you're in a better place to understand mental health from a medical point of view. And just be wary, just be compassionate about around the people around you, and take care of yourself. Like Davina said, your diet and your exercise, it's really really important. Everything is linked, your mental health, your physical health. So yeah, please take care of yourselves. And yeah, if you're new to the channel, thank you so much for joining us. And please subscribe, like, share. That we would like to grow this community. We want to get more people on like Davina who can share their knowledge and experience, and hopefully help, myself included, uh, shed more light on things that we're not aware of, or we didn't get educated on. So thank you guys, take care, please be safe, and hope to see you all back on the Real Talk very very soon. Bye bye.